Hi, my name is Geraldine Bates, and I'm a 2013 ADN graduate. I've worked as an ICU nurse for almost 10 years now. I've had plenty of positive and negative experiences throughout my career. Today, I will discuss my own experiences with this interprofessional collaboration assignment, including patient care, both effective and ineffective communication, and managing appropriate resources. I was given the assignment of a patient who was admitted to the ICU with the diagnosis of a GI bleed. She was a young lady with no other known health issues and had never been in ICU. Night one of my initial assessment, the patient was alert to person, place, and time. Her only issue was a small amount of bright red bleeding she was having from her rectum. The surgical team, along with the primary doctor, was aware and surgery was planned for the next day. The next morning, the patient went down for surgery and upon returning to the unit was stable. Night two of the patient's stay completely different than the first night. The patient had copious amounts of bright red blood coming from her rectum. She stated, "I feel like I'm going to die." She was gray in color and appeared to be somewhat confused and lethargic. I immediately notified the primary doctor and the surgical team to voice my concerns. The surgeon told me if the bleeding progressed to call back. I felt like something should be done quickly, so I discussed my concerns with my clinical nurse manager. He advised for me to keep calling the doctors back until they listened to me. As the night progressed, the patient became short of breath, and the rectal bleeding continued to worsen with large blood clots at this time. I became even more concerned and notified primary doctor and the surgical team once more. The only answer I received was to continue monitoring the patient. By this time, I was so frustrated from not being heard or my expertise valued that I notified my house supervisor. My supervisor came to the unit to evaluate the situation and agreed that the surgeon should be physically present. She then called the surgeon and advised he would be held accountable if he did not come see the patient. The surgeon finally agreed to come to the unit and assess the patient. As the patient continued to become increasingly short of breath, she eventually lost a pulse prior to the surgeon arriving on the unit. CPR was initiated and a code blue was called. Our ER doctor arrived to the unit and intubated the patient. She was placed on the ventilator and sedation medications were initiated. Once the surgeon arrives, the patient is taken down by the surgical team to have emergency surgery. Upon arrival back to the unit from surgery, the patient remained stable and on life support. The post-surgical diagnosis per surgeon was a perforated bowel. The post-surgical diagnosis and prognosis of the patient was discussed at this time with the family by the surgeon, the primary doctor, nurse, and respiratory therapy. Thankfully, the family's decision was to keep the patient on life support because she eventually made a full recovery. This event was possibly preventable had the surgeon listened to my concerns and investigated the situation. I made several attempts to get the doctors and clinical nurse manager to take immediate action, but they would not. It took going to my house supervisor and her trust in me when I told her the patient was possibly crashing. She personally had to notify the doctors to get them to take action. She had worked with me for a long time and trusted my judgment. Doctors need to trust more of what nurses say, especially if they are the primary nurse and have experience. We are with patients for 12 plus hours a day and know when something isn't right with our patients. According to a 2022 Journal of Continuing Education and Nursing article, when physicians respond in a respectful tone, regardless of the type of issue, acknowledge the nurse's perspective on the matter, and respond to the issue in a timely fashion. About the seriousness of the matter, the framework for a successful collaboration that brings about quality patient outcomes is provided. The outcome could have possibly been very different for the patient if the doctor continued to ignore the concerns of the nurses. Doctors need to address serious issues in a more timely manner. Nurses spend a lot of time with their patients and know when something isn't right. If more physicians would listen to their nurses' concerns, a lot of bad outcomes might not possibly occur. Positive patient outcomes should be the most important objective of any interdisciplinary healthcare team. Providing the best care to our patients is our main focus. That's why effective communication and respecting each other as a team is so important. Nurses need to know that doctors will value their opinion and take them seriously. Working together as a team and having effective communication can have a great impact on patient care. According to a 2020 article titled Self-Leadership Among Healthcare Workers, a skilled leader encourages autonomy and trusts the expertise of each team member. Nurses spend 12 and 13 hours a day taking care of a patient, far more than any other healthcare provider. So when nurses notice a change in their patient, the doctors should take their concerns and fears into consideration. According to a nursing management article from 2022, in the U.S., ineffective collaboration among the interprofessional team, including nurses and physicians, is a foundational cause of more than 70% of major medical errors, resulting in an annual cost of over $4 billion. Even with the knowledge that collaboration is effective in enhancing care quality, implementation can be difficult. To enhance collaboration between disciplines, nurses' perceptions must be better understood. Good, effective communication and respect among the healthcare team is very important in better patient outcomes and better financial results for the hospital as a whole. Effective communication and quick intervention is the key to better patient outcomes. Every healthcare team as a whole should feel heard and respected. Nurses should feel confident about speaking to doctors or anyone in the healthcare industry without feeling their viewpoints and opinions don't matter. As mentioned previously, nurses spend far more time with patients than anyone in the healthcare industry. In conclusion, our main goal is working together as a team for the best possible care of our patients. Thank you.